12 life hacks that can save your life in extreme situations. Usually, we recall advice from our relatives and friends, but even the most popular recommendations can sometimes be wrong or harmful. Did you know that applying ice to a bruise is not always the best idea? Or that you should never lift a person who has lost consciousness? Today, you'll learn about 12 well-known survival myths and the right actions to take in emergencies. Myth 12. Removing a foreign object from the eye. If you encounter a situation where a foreign object, such as a piece of glass, gets into your eye, do not try to remove it yourself. This can worsen the injury or even lead to serious complications. In such a situation, the best decision is to seek medical help immediately. If it's a less serious situation, such as an eyelash in your eye, it's important to take some precautions. First, thoroughly wash your hands to avoid the risk of infection. Then, look into a mirror under good lighting and try to locate the eyelash. Blink several times. This can help your tears move the object to the corner of your eye. Once the eyelash is visible, gently remove it with a damp piece of clean cloth or a cotton pad. Remember, any action should be performed carefully to avoid damaging the eye's mucous membrane. Even seemingly minor eye injuries can have serious consequences, so don't hesitate to seek professional help if you're unsure. Myth 11. Applying ointment to a wound. Many of us are used to thinking that applying ointment to an open wound is a sure way to speed up healing and protect against infection. However, ointments can create a moist environment that becomes ideal for bacteria growth. This in turn can slow down the recovery process and increase the risk of inflammation. To treat a wound correctly, start by rinsing it with cool water. Use mild soap to remove debris, but avoid harsh products that may further irritate the damaged tissue. Once the wound is clean, gently pat it dry with a clean towel or tissue to remove excess moisture. Then, apply a dry, sterile bandage. This will prevent dirt and bacteria from entering and create optimal healing conditions. In some cases, especially if the wound is deep or contaminated, it is better to consult a doctor. Professionals can not only properly treat the injury but also assess whether additional measures, such as a tetanus shot or antibiotics, are necessary. Thus, avoiding ointments for wounds is not only safer, but also a more effective way to help your body heal. Take care of your health and trust modern medical recommendations. Myth 10. Rubbing alcohol or vinegar to reduce fever. There is a common misconception that rubbing alcohol or vinegar on the skin helps quickly reduce a high fever. However, this method is not only ineffective, but also dangerous. Alcohol and vinegar are quickly absorbed through the skin into the bloodstream, which can lead to poisoning, especially in children whose bodies are more sensitive to toxic substances. Intoxication can manifest as dizziness, weakness, or even loss of consciousness. Additionally, alcohol and vinegar severely dry the skin, causing irritation and worsening the patient's overall condition. Instead of these outdated methods, safer and time-tested approaches should be used. First of all, ensure the patient stays hydrated with water, teas, or compotes to prevent dehydration. Regularly ventilate the room and maintain the air temperature between 16 and 18 degrees Celsius. And exclude other patients when feeling anxiety-ridden and depressed or calves to naturally lower body temperature. If the condition does not improve and the fever continues to rise, it is essential to seek medical help. Remember, self-treatment can be dangerous, so always consult a doctor when choosing methods to treat fever. Myth 9. Assisting someone who has fainted. When someone loses consciousness, many of us immediately recall the old advice: put the person in an upright position and splash cold water on their face. However, this not only fails to help, but can also make the situation worse. When dealing with a fainting person, it's important to act correctly to minimize health risks. First, do not try to lift the person who has fainted. This can worsen the episode or even cause additional injuries. Instead, carefully lay the person on their back, elevating their legs about 20-30 centimeters. This position helps improve blood flow to the brain and speeds up recovery. Secondly, loosen any tight clothing that may hinder free breathing. Do not attempt to give the person water, coffee, or other drinks. This can cause choking, especially if consciousness has not fully returned. If the person regains consciousness, do not let them stand up immediately. Allow the body time to adapt. If the fainting lasts more than a minute or recurs, call an ambulance immediately. It is especially important to remember that in some cases, fainting can be a symptom of serious conditions, such as heart problems or neurological disorders. Myth 8. Treating burns with oil or sour cream. Many believe that sour cream or vegetable oil is the best way to relieve pain from a burn. However, this is far from the truth. These products do cool the skin in the first few minutes, but not due to their properties, rather because they are stored in the refrigerator. The main danger lies in the fact that oils and sour cream form a dense film on the skin, disrupting heat exchange. This leads to heat from the burn penetrating deeper into the tissues, exacerbating the damage. Additionally, such remedies can dry out the skin, slowing down the healing process and increasing the risk of infection. What should you do in case of a burn? First of all, place the affected area under cool running water for 15-20 minutes. This helps lower the tissue temperature and reduce pain. Then, gently pat the skin dry with a clean, soft cloth, avoiding rubbing to prevent damaging the affected layers. Cover the burn with a sterile bandage to protect it from contamination. Do not use creams, oils, or other home remedies on burns without a doctor's recommendation. If the burn is deep, covers a large area of the body, or is accompanied by blistering, it is important to seek medical attention as soon as possible. Myth 7. Attempting to reset a bone on your own. Popular movies and TV shows often depict heroes easily resetting dislocations or fractures on their own without seeking help from doctors. At first glance, this may seem like the right thing to do, but in reality, such actions can do more harm than good. First of all, if you are not a professional traumatologist, you cannot assess the extent of the injury. Attempting to reset a bone can cause additional damage, such as injury to nerves, blood vessels, or soft tissues. This can not only increase the pain, but also make the recovery process longer and more complicated. Secondly, such actions can worsen a fracture, turning a simple fracture into a complex one that requires surgical intervention. What should you do in such a situation? First of all, it is important to immobilize the injured limb. Use improvised tools such as a board, stick, or dense piece of fabric to fix the limb in a position that causes the least pain. Apply the bandage carefully, avoiding too much pressure so as not to disrupt. Myth 6. Treating sprains with heat. Many believe that applying a warm compress is the best way to relieve pain from a sprain or muscle strain. However, using heat in the first days after an injury can do more harm than good. Heat increases blood flow to the injured area, which can lead to increased swelling and inflammation. Therefore, using heat at the initial stage of treatment is not recommended. The correct approach is to use cold therapy. Apply ice or frozen products wrapped in a cloth to the injured area for 15 to 20 minutes. Do this every 2 to 3 hours during the first 2 days after the injury. Cold helps reduce swelling, relieve pain, and prevent further tissue damage. However, do not apply ice directly to the skin to avoid frostbite. It is also important to rest the injured limb. Avoid excessive activity and stress to prevent worsening the injury. If necessary, use an elastic bandage for support, but do not wrap it too tightly to avoid disrupting blood circulation. If the pain persists for more than 2 days, swelling increases, or movement issues arise, consult a doctor. A specialist will conduct an examination to rule out more serious injuries, such as ligament tears or fractures. Heat therapy can be beneficial in the later stages of recovery when the inflammation has subsided. However, in the early stages, cold is your best ally. Take care of your health and trust proven treatment methods. Myth 5. Inducing vomiting after poisoning. Many believe that inducing vomiting immediately after poisoning will help eliminate toxins. However, this approach can be not only ineffective, but also dangerous. Vomiting can increase the exposure of toxins to the body, especially if caused by chemical substances, acids, or alkalis. As these substances pass through the esophagus and throat, they can cause severe burns and worsen the damage. Another danger is the risk of toxins entering the respiratory tract. This can lead to choking or lung inflammation. Additionally, excessive vomiting causes dehydration and worsens the overall condition of the body, especially in children. If you suspect poisoning, it is best to seek medical help as soon as possible. Until doctors arrive, you can take measures to minimize harm. For instance, Drink a small amount of water or milk to reduce the toxin concentration in the stomach. However, avoid drinking large quantities of liquid, as this can trigger vomiting. In some cases, doctors may recommend taking sorbents, such as activated charcoal, to absorb toxic substances. However, even these actions should be coordinated with a medical professional to avoid side effects. Remember, not all poisonings require the same approach. Symptoms and treatment depend on the type of substance that caused the intoxication. Therefore, self-treatment may be insufficient or even dangerous. Take care of your health and always consult a doctor if poisoning is suspected. Myth 4. Saving a drowning person. Many of us have seen in movies how a hero jumps into the water to save a drowning person, but in real life, this can be much more challenging and dangerous. A drowning person is in a state of panic and may instinctively grab onto their rescuer, creating additional risk for both. If you decide to help, it's crucial to follow specific safety rules. First, if you are unsure of your swimming abilities or are not a strong swimmer, do not attempt to rescue the drowning person yourself. Instead, use a lifebuoy, rope, or any other suitable item to throw to the victim. Keep verbal contact with them to maintain hope. If you are confident in your abilities, approach the drowning person from behind to avoid their instinctive grabbing motions. Grab the victim under the armpits or by the chin and keep their head above water. Swim to the shore backward, using your free hand to propel yourself. This allows better control of the situation and reduces the chance of being grabbed. After delivering the person to shore, immediately check their condition. If they are not breathing, begin cardiopulmonary resuscitation, CPR, and call for an ambulance. Even if the person seems fine, it is essential that a doctor examines them, as complications such as secondary drowning or water in the lungs are possible. Remember, saving a drowning person requires composure and proper actions. Take first aid courses to prepare for such situations and help not only others but also yourself. Myth 3. Removing foreign objects from wounds. Many mistakenly believe that a foreign object in a wound should be removed immediately. While this seems logical, such actions can cause more harm than good. When a foreign object, such as glass or metal, remains inside a wound, it may act as a plug, slowing bleeding. Removing the object without proper preparation can increase blood loss and cause further damage to surrounding tissues. If you find a foreign object in a wound, it is essential to immobilize it. Use sterile materials to create a barrier around the object and prevent it from shifting. This helps minimize the risk of further injury. Never attempt to remove the object yourself, especially if it is deep or near vital organs. The next step should be to seek medical help immediately. Only specialists can safely remove the foreign body in sterile conditions using the necessary tools and methods. This also reduces the risk of infection and potential complications. Remember, attempting to remove a foreign object from a wound on your own can lead to severe consequences, including damage to blood vessels, nerves, or internal organs. Trust professionals and ensure the wound is protected until doctors arrive. Take care of your health and avoid unnecessary risks. Myth 2. Applying ice to a bruise. Many believe that ice is a universal remedy for bruises. However, improper use of ice can worsen the situation. For instance, applying ice directly to the skin can cause frostbite, adding pain and discomfort. To avoid this, wrap the ice in a cloth or towel before use. It is also important to know that ice is effective only during the first 48 hours after a bruise appears. During this period, it helps reduce swelling and prevent the spread of the hematoma. Apply ice for 15-20 minutes, then take a break of at least an hour. Prolonged exposure can cause harm. If you do not have ice, frozen products can be used, but they must also be wrapped in cloth. If the bruise is accompanied by severe pain or swelling, consult a doctor to rule out more serious injuries, such as fractures or tissue tears. Remember, ice is only part of a comprehensive approach to treatment. After the first 2 days, applying heat can help speed up recovery. Follow these recommendations to minimize the effects of injury and recover faster. Myth 1. Suturing a wound. Many believe that any wound, especially a deep one, must be sutured. However, this is not always the case. In some situations, special skin adhesives that effectively seal wound edges and prevent infection can suffice. These adhesives are convenient to use and minimize discomfort. Before applying adhesive or sutures, thoroughly clean the wound. Use cool water and mild soap to remove debris. Stop the bleeding by gently pressing a sterile dressing on the wound. If the wound is small and the edges are easy to align, skin adhesive can be a great alternative to sutures. It dries quickly and does not require removal. However, deep, heavily contaminated, or ragged wounds are better treated by professionals. A doctor will assess the need for sutures to prevent complications and ensure proper healing. Remember, self-treatment can lead to infections or improper healing. Taking proper actions during emergencies can significantly improve outcomes and even save lives. Understanding the myths and following correct, evidence-based advice is crucial for ensuring safety and health. Whether treating minor injuries, assisting in serious situations, or seeking medical help, staying informed and prepared makes all the difference. Remember, timely and thoughtful decisions can turn a potential disaster into a manageable situation. Always prioritize learning basic first aid and share this knowledge to empower those around you. Stay safe and stay prepared.